Good afternoon, ladies and gentlemen, and welcome to another MIDF Conversation, where we host a lunchtime conversation between MIDF and captains of industry and thought leaders. This is a keto lunch for the intellect. No carbs, no starch, just the good stuff. Pure protein and some greens as food for thought. I would like to welcome all our participants, the entrepreneurs, CEOs, fund managers, and finance and business professionals, the individual investors investing their own hard-earned money, members of the media, students, especially those studying mass and economics, colleagues, and everyone. I am absolutely delighted and honored to have with us today the Chief Executive Officer of Thomson Hospital Kota Damansara and the Group Chief Executive Officer of TMC Life Sciences Berhad, Nadiah Wan. Good afternoon, Nadiah, and thank you so much for joining us today. And congratulations on being named as one of Forbes Asia Power Businesswomen of 2021, the youngest and the only Malaysian on that list. Congratulations. So Nadiah, thank you for coming on the show.
Thank you for having me.
It's great. So we have almost an hour to chat about all kinds of things. But could we start and just talk a little bit about how you got here? You're one of the youngest CEOs in Malaysia, and forgive me for saying so, but also a woman, and both tend to be things which make it harder to become the CEO, and you've broken through the glass barriers in both. So tell us a little bit about how you got here.
This is the dreaded question.
Okay, we're going to talk about that.
Yeah. So I went to normal public school, and I was on track to go to. I was in matriculation in University Malaya when I had applied to get a scholarship to go to the US. At the time, it was 2001. And my logic was, A, I really wanted to study the liberal arts because I wasn't sure what I wanted to do in life. And B, September 11 had just happened, and my logic was that there'd be less people applying to the US than the UK. So, JPA took its own sweet time, but they finally gave me a scholarship, and I was lucky enough to score a spot at Harvard. So I did biochemistry there. My mother always told me that I did not have a temperament to be a doctor because I'm impatient and not very empathetic, according to her. And so I did biochemistry. And we're studying virology, actually. My supervisor at Harvard is now head of Pfizer vaccines. Wow. And while I was at Harvard, I did research at Boston Children's Hospital with my supervisor on rotavirus and discovered that academia was not for me. And I was sort of wondering, what do you do? The Harvard at the Harvard Club, the president was Tan Sri Lin at the time, the ex-deputy governor. He said, why don't you try and do an internship with BCG one junior summer? So I came back, I did an internship at BCG, and they offered me a job at the end of the internship. So I went back to Harvard, finished my degree, and said, come back to Malaysia, work for BCG, which I did for 2 years. And then I decided to pursue my master's in public health. And again, my logic was, there's a lot of people with MBAs, but my interest has always been in biology. So I'll do a master's in public health and subspecializing in nutrition because Malaysia has an obesity problem. So I managed to get a Maxis scholarship for postgraduate study. I went off to the London School of Hygiene and Tropical Medicine because I had already gone to the US. And so I thought I should experience the UK education system. So off I went. And when I came back, I actually thought, because you're working in public health, I thought I would work with the World Food Program, or I came back and applied to work with the Jeffrey Chia Foundation. I had this interview with Tan Sri Jeffrey Chia, and he was like, totally wasted for you to work in the foundation, come work at the corporate strategy office. And I said, well, I don't want to go back to strategy, but they said, you come join us and then maybe you can go work in healthcare or education. We have all these subsidiaries. So that was fine. So I worked at Sunway for a year, helped them do the merger for Sunway Berhad with under the PMO, the merger integration office. And after that I was seconded to the hospital. And when I started working at the hospital, then I realized, this is actually fun, healthcare administration. And so the timing was such that there was a new CEO that joined when I joined. And as often happens when a new CEO joins, a lot of people under the CEO resigned. And so there was a lot of vacancies. And the new CEO who's now Datuk Lau, said that, why don't you try your hand at any one of these positions? There's HR, there's procurement, there's marketing. So I picked marketing, and I became, I think, the director of business development and marketing at 27.
Wow.
And when I took that post, I clearly remember then all the managers resigned because obviously they were older than me and they thought they should be having the position. So learned the hard way about leadership and building your own team and setting a direction. So off I went, and at Sunway, I actually every year, when you're in marketing and then there's a unit that's not doing well, they're like, okay, put it under business development, see if they can turn it around. So I gained a lot of operational experience, and then I became COO at Sunway, heading clinical services. And I think my background in biology definitely helped a little bit on that. And then Tropicana Medical Centre at the time came knocking, and they offered me the CEO position. And I thought it was a relatively small hospital at the time, so I'd give it a try. And yeah, so there I was the CEO of the hospital at 32, I think. Yeah. And it's been a roller coaster ride since.
Brilliant, absolutely brilliant. So, but you're also the CEO of TMC Life Sciences. So
yeah, so 2 years after I joined, they were like, I think we can put a Malaysian, with previous group CEO was Singaporean, and I think they felt that it would be good to have a Malaysian hold the post. So 2 years after I joined TMC as the hospital CEO and the chief corporate officer, they promoted, the board appointed me as executive director and group CEO for the listed holding company as well. So yes.
I see. So you run the hospital and run the group as well at the same time.
Yes. I have a very good supporting team, as you can imagine.
Gosh, you get things done. You're a scientist, and that's brilliant. I mean, I love scientists. Lots of people talk rubbish, and scientists kind of sort of know what they're talking about. But you said earlier you wanted to do liberal arts in the US, but you changed your mind and did science. Is that always what you always?
No. I mean, I did science, but in the liberal arts education, basically, I think like 50% of your courses are within your concentration, and 50% is not. So I really enjoyed that, and I went all out crazy. I did classes in medieval architecture, music, literature. Studied hallucinogenic plants in Costa Rica while learning Spanish.
My goodness.
So I made full use of my time in undergrad.
That's a well-rounded education, and you saw lots of things. So I'll talk a little bit about COVID. I know it seems like COVID is almost over, but it's still with us. Yeah? And you're particularly qualified to talk about it. It seems that you are a virologist. Or virologist, is that the right word? Yes. You are a virologist, and you know this thing. So what's your take on COVID now? Where are we in terms of the epidemic? Is it still bad? Do we still have to be very, very frightened? Or do we just pretend it's like the normal flu and take it as it comes?
I think there are two things that we need to be concerned about. Number one is the fact that a majority of the world is not vaccinated yet. And until we do that, then we're going to have new variants popping up. Number two, there's a lot of talk about endemicity. And being endemic means that you have sort of a steady state of infection within the population that the system can cope with. And what we're facing with the Omicron variant now is not really endemic in a sense, because you have a very acute spike in the number of cases at the same time. And people are ending up sicker and sicker, particularly those who are unvaccinated or who don't have the booster shot, and also children who by and large are not vaccinated. So to say that we have reached an endemic state, not yet by a long shot. And we really need to address this issue about vaccine equity, and also to bring down the levels of infection to a steady state so that the entire health ecosystem is able to manage. Because what we're facing now in countries like the US is that you have a huge spike of infection, and you have a lot of people who are unvaccinated or without a booster who are ending up very sick. But we also see, like in countries in Denmark and the UK, this phenomenon which we call decoupling, where they have a high load of cases, but the number of deaths is still relatively low. So that's where we are right now. I'm hoping that in the next year or two, the world collectively figures out how we can provide vaccines to a large proportion of the world, like particularly, I think, in Africa and a lot of underdeveloped countries. And recently there was an announcement by Texas Children's Hospital, who have developed a vaccine called Covivax, which is a protein subunit vaccine, and they're giving it free. Wow. To any country. So India has emergency use authorization to produce this vaccine for their population. And I'm just hoping that perhaps the development finance institutions or the World Economic Forum or whoever it is really looks at investing into increasing supply of vaccines for the world, because to sort of like morally tell countries to donate their vaccines, rather than keeping it for their populations hasn't gotten us anywhere.
So I didn't hear about this. So this vaccine development in Texas is available. Anybody can make it and sell it.
Yes, basically.
Wow, that's a game changer if there ever was one. I think.
Yeah, but I think the manufacturing capacity now, that's the issue, because making vaccines is not that easy. I think India, having produced a lot of pharmaceuticals and generics in the past, does have had that infrastructure, but we really need, I think, as a global community, need to look at upscaling manufacturing of critical supplies like vaccines.
Okay. So you look at some of the UK. I mean, you see, I've not been to the UK for a long time, and people I know, many people from Malaysia have been there. But it looks like that life's almost back to normal in some countries in Europe. Right? They're going around without masks and having lots of parties and just mixing around. Is that sustainable? Is that...
Well, I mean, the difference between Malaysia and the UK is that pre-COVID, I think the Malaysian public health system was already dangling at a precipice, and COVID was just like not even a straw, maybe an entire kayu balak that broke the back. And so, what we're seeing is like probably decades of underinvestment, perhaps in public health. The fact that, we've had longstanding issues with healthcare talent pool and supply and things like that. And this is just, something that we cannot cope with. But I do want to caution people that Malaysia as a country is not the same as we were last year. Last year in July, the healthcare system collapsed in the Klang Valley. People were by and large not vaccinated. We had a lot of deaths. We had a lot of brought in dead people. You remember the pictures of people lying outside the emergency departments of public hospitals and just, it looked like a war zone. And I was there visiting, and it was indeed a war zone and a very demoralizing time for people in healthcare. But now we have a very high vaccination rate. We hope that we can increase the rate of booster doses, and I think we have made improvements in our public health interventions, particularly in contact tracing and reporting of cases. Testing capacity has also increased. So we're not exactly in the same position as we were last year, but still, I think by and large, if we were to face a huge spike of people needing admission, we still have that constraint of not having enough beds and doctors and nurses. So I think the government is taking a much more cautious approach, but we know that the Minister of Health has already announced that we would not go back to lockdowns. Lockdown was an option when we had no other bullets, I guess, in our arsenal. But now that we do, I think it should be an option that's not on the table until we have exhausted everything else. And so now it is really about moving our way towards there. But I think this masking and ventilation thing will not go away. So perhaps it's a reality that we all have to adjust to, particularly because I think with children, they're not vaccinated yet, right? So we will always have this vulnerable population. So I don't see some of these public health interventions going away just yet.
So, okay. So you're saying is that wearing masks will just be normal.
Yeah, and what I would want to see, frankly, is a lot more corporations and organizations taking up the responsibility for ventilation. Basically, any building, commercial building, should be really looking at the redesign of the airflow, because we all know by now that COVID is airborne. Masking, yes, is an individual responsibility, but I don't think we talk a lot about corporate responsibility of ensuring that the workplace is safe, ensuring that the places where people gather are safe. I still see some places they put up plexiglass barriers that actually inhibits flow. And studies have shown that it actually is not good when you're looking at an airborne disease. So a lot of these things, that I think that, corporates like us need to step up and do our part to make sure that people are safe, within our premises.
All buildings are air conditioned in Malaysia. I mean, KL can't survive without air conditioning. I mean, not the KL we've grown to know today, right? So, I mean, what are we supposed to do? Stop? Switch off the air conditioning?
No. See, the hospital is still air conditioned. You don't have
Right.
to give up your precious AC. But MOH, together with University Malaya, released some guidelines on how you can improve airflow, which includes like either having standalone purifiers, something that's relatively low cost and easy to do, to installing HEPA filters in your AHU units, to even reversing airflow. So most commercial buildings, the airflow will have an intake and an outtake. And the placement of where the intake and outtake does can actually play a part in reducing your risk. So there are things that we can do. There are guidelines out there, but I don't hear people talk about it much. So if anything that people around here take away from this talk is have a look at those guidelines and really have a serious conversation at the board level, the management level about what we can do to help safeguard people in our buildings.
That's great. No, well, there's definite takeaway from this. And, my colleague, Jemale, I hope you're listening, because we'll definitely implement it in this building. But yeah, but on one hand, maybe quite good. Maybe we should all kind of live outdoors anyway. I mean, we live in a tropical country. We don't have to stay inside buildings, right? Go to outdoor markets, eat outdoors at night. It's much.
Yeah, maybe architects will change the way they design buildings to incorporate more natural ventilation. It's also, good for ESG, reduces your energy footprint.
Yeah, it's good all around.
So a lot of conversations happening around this, in terms of health, in terms of ESG. And I think it's good. Like, the pandemic has really brought these conversations to the fore.
Brilliant. By the way, ladies and gentlemen, if you have any questions, just type them in the Q&A box, and we'll get to them. But we won't go there yet. So I guess everyone. That's really interesting. But you said earlier that you studied nutrition and public health in the London School of Tropical Hygiene. I love that name. Hygiene, tropical. It's very 19th century, very Victorian name. But you studied that, and you talked about the obesity problem in Malaysia. That is true, isn't it? We do have an obesity problem.
Yeah.
Are we kind of the heaviest in Asia or something like that?
Yes, I think in terms of obesity and diabetes, we are the worst in ASEAN. I think 1 in 4 people are actually obese if you just look at the BMI calculation. And there are a lot of undiagnosed diabetics that actually are walking around in the population. And this is where the conversation with policymakers are coming to the fore, because when you have underlying comorbidities and then you get hit by something like COVID, the outcome is a lot worse, the care is a lot more expensive. And so this focus on NCDs is really becoming a big issue. And there's a lot of things that we need to work on, because a lot of the preventive health measures, and I had tweeted about this, I think, a few days ago, because it just struck me that we're talking a lot about obesity, diabetes. I was listening to Deputy Minister of Health talk about, how severe our NCD burden was. And yet things like dietary counseling are not covered by insurance. And so, we have a payment structure that is geared towards therapeutic and not really preventive health. And yet we're faced with things like COVID and NCDs that actually require more preventive public health interventions rather than hospitalization and therapeutics. So this disconnect is something that we need to sort out. Otherwise, we'll never solve the problem.
No, I mean, it is true. Isn't it? Prevention is better than cure. I mean, it's not just an old saying, but it is true. So non-communicable diseases, that includes things like heart disease and
basically things related to your lifestyle.
Right. Lifestyle diseases, that's right. So we should all stop eating sugar and eating rice.
Yeah, do you know that sugar is even more addictive than cocaine?
Wow. Okay. We've got a lot of sugar. So now that you're running a for-profit organization in Thompson, and congratulations, by the way, on the awards. I didn't realize how well the Thomson Hospital is doing until I saw your video, and you're doing all kinds of things, right? And not just kind of in traditional medicine, but even traditional Chinese medicine. I saw. Is that a big element of the business?
No, I mean, it's part of our vision to build an integrated holistic platform. And because we have big practice in tertiary care and fertility, acupuncture and Chinese medicine has a very nice synergy. So we actually do refer a lot, and a lot of our patients actually want to have Chinese medicine therapies like acupuncture and so on and so forth to improve their pregnancy, stroke, and pain management. So it's not a big part, but it's definitely an important part because we want to be an integrated health platform that offers, all sorts of services that our patients would need. So yeah, it's been doing quite well, and we're going to open another new branch soon in Kota Damansara.
That's interesting because I mean, you're a scientist, so it's clinically proven that things like acupuncture.
Yeah, do you know our health DG is a big fan of acupuncture, and he has actually done thyroid surgery without anesthesia, purely using acupuncture as a pain block.
Wow. You're a very brave person, actually.
There are some people who are allergic to anesthesia and do not have a choice.
Wow.
But yeah.
Well, hang on, what, you stick some needles in you and then the doctor can cut you open?
Yep.
And you don't scream in absolute agony?
You don't feel anything.
Gosh, okay. And what else? Does this also include things like herbs and stuff like that?
Yes,
the things
yes.
You kind of
It's a very well-established path in China. So a lot of TCM physicians in Malaysia have 4-year degrees from Chinese universities, good ones, like Peking University, Shanghai University, Tianjin. And so, they do all sorts of therapeutics. They even subspecialize. So our physicians subspecialize in orthopedics, fertility and reproduction. So it's progressed a lot in China. And I think what's happening in Malaysia, it's become more structured. And more healthcare groups are looking at alternative medicine, and people are just in general looking at more wellness kind of services as well.
Yeah. Wellness is a funny word though, because it covers spas, and let's talk about spas as wellness. I don't think it's really wellness, and there's other things like good diet.
Well, maybe good for your mental health, which is another big thing that people are talking about since the pandemic.
And you do something for mental health as well, do you? In Thompson?
Well, obviously we have counseling, psychologists, psychiatrists, but in the past 2 years, we've focused a lot on mental health for our employees. And, we gave free counseling sessions. And then recently during Employee Appreciation Week, we had sort of expressive dance therapy and things like that, just trying out new things. But I think it's really important that employers and, people just in general have more awareness about the mental burden of the pandemic, which is real, right? Because the suicide rates have increased, divorce rates have increased, and we need to take care of people as a whole. Otherwise, then, there'll be a lot of unnecessary suffering.
No, you're right. I mean, there are all these things happening. So if I can just go back again to the hospital. I mean, could you talk a little bit about what you're doing there and the kind of the direction it's taking?
Okay, so basically TMC Life Sciences has like 4 main subsidiaries. So we have hospitals, we have fertility branches and ambulatory care, I would say. We have retail pharmacy, and we have Chinese medicine. Obviously, the 2 biggest contributors are hospital side and fertility. For the hospitals in general, the strategy has been, we don't have many hospitals, but where we have hospitals, they're big and they're comprehensive and they're flagship. So it's something more like Bumrung Rad, rather than, Columbia, Asia. And the reason is because I think in healthcare, what we see is the trend is diverging. So you either need hyper-specialist care, things like cancer, nuclear medicine, things like that, or it's moving more towards outpatient day surgeries, ambulatory at-home monitoring. And we can see that very clearly in COVID, where you have people who are infected and they can be monitored at home, and you only come to the hospital when you need it. And in this way, you kind of manage the sustainability of the cost of medical inflation. So realistically, if we were to build a hospital, it would have to be comprehensive, because I think the middle ground is kind of thinning. And where we are at Thomson Hospital is that we had 200 beds. We recently completed 2 additional wings, and starting this month, really, we are adding on about 400 beds to the capacity of the hospital, and a lot of new services. So cancer, nuclear medicine, all the big tertiary services so the hospital's growth is there. And we have another development down in Johor, which is called Thomson Iskandar, but it's not actually in Medini. It's actually in Tulang Laut, which is like 10 minutes away from the customs and immigration at the causeway. So that development, I think Johor is more of a long-term play in a sense, especially with border closures and such. But I think that it's good that the government has committed to continuing the MRT project. Our site is 10 minutes away from the Bukit Chaga station. And so I think that when all the infrastructure pieces come together, it would be a very good project that would ride the wave of recovery and growth in Johor. So other than that, we are also part of Thomson Medical Group in Singapore, where I've just been appointed as director this month. Yeah. And so we have looking at a consolidated regional footprint, really. So now we have a presence in Singapore, Malaysia, and Indonesia, and then looking at how we can grow. So Singapore is slightly ahead in the sense that they have tertiary hospitals, and the government doesn't even issue licenses for hospitals anymore. And most of the growth has been coming from these community ambulatory care centers. So Thompson in Singapore, for example, has a hospital, but it has 37, I think at last count, clinics around Singapore. And I really think that this is how, healthcare services will progress, and it'll only be a matter of time in Malaysia where we see these ambulatory care or daycare centers and clinics really coming to or becoming more predominant rather. Yeah.
Great. So who are your clients? I mean, do most people pay for themselves, or do they have insurance coverage? Because I mean, it's not cheap.
70% is about in corporate or insurance. Some have the employers paying, and then 30% is out of pocket. Mostly because I think women, children, fertility, all those are traditionally not covered by insurance. Right. So I think that that's something, and we also in the last year received decanted patients from public hospitals. So the government did pay. What does that mean? Decanted. From the bottle. So they poured from the public hospital to the private hospital because they couldn't cope. But I think the arrangement is likely to continue. It's good that the government has now realized that public-private partnership is important because the resources are within the country. We need to maximize the use. And so they've put in place these processes to actually purchase health services from private sector players. The National Immunization Program is a very good example of that. They pay private practitioners, I think about 16 ringgit per jab. And that's it. So the private practitioners have to deal with everything else, the venue, the manpower, the logistics and whatever. And at the end of the day, that's how they managed to roll out the vaccination population-wide as fast as they could, because I think about 90-something% of primary care practitioners are actually in the private sector, GPs.
Yeah, you go to a doctor, you go to clinic,
Yeah, correct.
That means going to see a GP.
Yeah, so very few people go to a clinic because they had done right. And they may go to a public hospital, but the first port of call is typically a private GP.
Yeah. We didn't do it, whose businesses were badly affected during the lockdown, but that's another subject. So the fertility clinic, it's interesting that's by itself as a business, as a standalone business, that's clearly a growing area, isn't it?
Yeah, again, with our fertility clinics, we also had the same strategy where each of our branches are actually standalone, which means that they're a clinic, they have an operating theater, they have a fertility lab, they have recovery bay areas. So it's a one-stop shop, basically. You can go there, you can get end-to-end fertility treatment and without having to go anywhere else. And I think fertility, given the demographic changes across the world, is a service that is only going to increase in demand, clearly. So I think, and COVID, bad news for the guys and whatnot, has been shown to have an effect on fertility, on the quality of semen, for example. And so we anticipate that actually demand for fertility services will definitely increase. And of course, in recent years, I think awareness has improved. People do come in for fertility screenings. rather than trying to experiment and bumble their way and then 3 years later walk into an IVF clinic. So I think that that cultural shift has also helped a lot in terms of raising awareness.
No, I mean, birth rates have been dropping around the world. And in Malaysia, the birth rate really has dropped. And I think in in certain parts of Malaysia, that's well below the replacement rate.
I think that's why previously they allowed, I think, EPF withdrawals now for IVF, because insurance still won't cover, but they would allow EPF withdrawal for IVF.
But what is it? Is there an epidemic, or is it a medical cause for this, or just lifestyle changes?
Lifestyle is one. Obesity. A lot of times the doctor can just tell the patient to go on and we have a weight loss regimen for our IVF patients.
My goodness.
And once they lose a certain amount of weight, they get pregnant.
Wow.
So it's lifestyle, it's also environmental. We see patients from China who, when you do the test, I think there was a lot of environmental, I wouldn't say pollution or contamination or whatever it is that does affect. And it's also societal, right? People getting married later, postponing having children, that kind of thing.
Gosh. Yeah. Okay, so it's real. I mean, one never knows sometimes.
Yeah, we are not the only government struggling. I mean, I was in Dubai, I was talking to the health authority there, and the government actually will pay for the citizens to have up to 4 kids under IVF because they're also facing population decline.
No, it's happening all over the world. I mean, Thailand's much more than Malaysia, but Malaysia's catching up. We'll be well below the replacement rate very soon. Gosh. Okay, and a final question for you, just before we go to Q&A, is aging. Malaysians are aging, right? We have an aging. Is that part of your business as well now? We're talking about ambulatory healthcare and larger hospitals. Is that the fact that just people are getting older and sicker?
Yeah, I mean, definitely, right?
Getting sick. Yeah.
You will notice that most of the healthcare consumption is probably in the last 10 years of your life. And so, I mean, that's essentially how insurance works anyway. But the key thing here is that I think we want people to age in a healthy way and sort of like lengthen the amount of time that they live a quality life, which means, I mean, a survey showed what are the top 3 fears of patients, right? 1 was chronic pain. 2 is having a bad diagnosis like liver failure. And the third one, I can't remember what it was, but I still remember the top 2. So it's people are looking forward to not just living longer, but that extra years of life has to have good quality. And this is where I think really being a partner with patients in terms of like helping them manage and where this preventive health really comes in is really important.
Gosh. Wow. Sobering subject. Okay, first questions from Zufazlin Baharudin. What is your plan for this year for the company? And then you plan to venture any other businesses? You already spoken about your businesses. Anything more you want to add on this?
Yeah, I mean, in Thomson Medical Group, we have set up a new arm called Thomson X, which is just focused on investing in up and coming health tech innovations. I definitely think that healthcare is ripe for disruption. We have been very risk averse and conservative, and even sectors like financial institutions who are risk averse and conservative have moved on. And so it's inevitable that that people in healthcare will have to face this. And secondly, we have a global shortage of healthcare talent. You will see a lot of people resigning, even in the US and UK, burnout and things like that after the pandemic. So definitely healthcare technology is something that we're looking at very seriously. So within the hospital, we are transitioning not just to EMR, but looking at implementing CRM systems, looking at queue management, which is essentially flow and efficiency systems, and a lot of other systems to see how we can actually use technology to provide more efficiency and also give a better patient experience.
Okay. There's the next question here is on return, which I won't bother going through from anonymous. Another one is, being a scientist, behind the scenes heavy work, how did you transition to the corporate world, more so leading a corporate entity and the healthcare? Any tips to share? I mean, you talked about your journey, but do you have any tips?
Well, I had 2 years of BCG training. So when you join as an associate in a consulting firm, obviously, one, I think I benefited because at the time when I joined, most people would have an MBA or some sort of business and accounting background. Very few people had a science background. So I got put on the life sciences projects, but also I think good grounding in terms of teaching you about, how to read financial statements and things like that. So it was a good finishing school. But really, I think success is about whether you're interested in what you're doing. Otherwise, you wouldn't want to put in the additional effort and work that's required to really excel in it. And when I started working in healthcare administration, I knew this is what I wanted to do because healthcare is so wonderfully complex. It still has a basis in science. You can literally see the outcome of your work when happy people walk out the door. So I think it's been a learning process over the past 10 years or so since I started work. Continuously learning, of course.
Brilliant. Next one. How are you? What do you think about boosters? Are you pro boosters or anti-boosters?
Yes, please get your boosters. I mean, Omicron is the dominant variant in the world, and all the studies have shown, regardless of what vaccine you took, you need the booster to deal with Omicron. And so please, 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 we have boosters for free in Malaysia. Please take your booster.
Brilliant. I've had my booster. But what do you say to anti-vaxxers actually? When an anti-vaxxer person comes up to you and says,
there's a lot of time.
Have you ever been able to persuade an anti-vaxxer that vaccination is a good thing?
A lot of times, I think when the government didn't exactly mandate, but they made it very difficult for people without vaccinations to function normally. I think a significant number of people who were on the fence then took the vaccine. So say what you like, but I think this non-mandate mandate actually helped push the vaccination up. And the people who remain as anti-vaxxers are really those who either have a very strong religious conviction or are just so emotional that just talking to them with facts isn't really working. And so it's either a process of engaging them over time or just understanding the root of their personal beliefs that are so, it's a breakdown of trust, I think, with many of them, the suspicion that they have. And so, I haven't really found it very successful engaging with anti-vaxxers, to be honest. And I think, vaccines, the COVID vaccine in particular, unlike a smallpox vaccine, doesn't give you sterilizing immunity. It means that, like for smallpox vaccine, if you take it, it's likely that you will stop transmission of smallpox. And that's how we eradicated smallpox. With the COVID vaccine, it's not sterilizing, but it will reduce your risk of getting severe complications. But because it's not sterilizing, people assume that because we've been vaccinated, COVID is still spreading, that vaccines don't work, which is absolutely not true. Because if they didn't work, a lot more people would be dying. But I think sometimes vaccines are also victims of their own success, right? Like people saying like, oh, why do we need measles vaccines? Because measles is not around. Well, actually, measles is not around because people got vaccinated. So there's a lot of this. And, I really think psychologists need to study this and figure out how we can rebuild that trust, sources of disinformation, which, by the way, there's a study that shows that Malaysia is as susceptible to disinformation as any other country in Europe or the US, where sometimes we see the news and we think like, are they crazy? But actually the rate of disinformation in Malaysia is also fairly comparable with the rest of the world. Strangely, the study found that Thailand was a lot lower, and I don't know, maybe it's like a language barrier thing or something, but yeah, Malaysia, same as the rest of the world.
No, we're quite happy to accept anything which is sent to us by WhatsApp. We'll believe it. If it comes to us, no matter how outrageous, we'll believe it. Like, what's his name? Yes, Bill Gates and vaccines. Do you have a favorite vaccine? Is one vaccine better than the other?
If I had a choice, I would have taken a mix just to cover all the bases because they activate different things. So I think people who got AstraZeneca and Pfizer probably lucked out the best.
Right. Oh, I'm glad you said that. Yeah. It's true, isn't it? You should have tried a British vaccine, an American vaccine, a Russian vaccine, and a Chinese vaccine. Then you should be okay. Yeah, I don't know what happened to Sputnik. It's not here yet. Okay, the next one is next question is Harvard the best university in the world? And
I know.
and how much do you think Harvard put into you, or it's more that you had it anyway?
I think Harvard it's a very rich university, let's be honest, which means that there's a lot of resources that pupils have access to in terms of talent, in terms of money, in terms of opportunity. If I didn't go to Harvard, I would not have been exposed to a lot of different subjects like Soviet history, architecture, a lot of things that I think you have these critical conversations and that shape you as a person. I think the liberal arts kind of prioritizes grooming people to become adults. And this sense of service that we have at the university as well, because we all know we're very lucky to get into Harvard, and it's always constantly pounded into us. What do you do with all that privilege that you've been given? So I think, yeah, it definitely shaped me, and it gave me opportunities. Like I said, I studied in Costa Rica, learned Spanish, studied shamanism and hallucinogenic plants. I took up rowing and mountaineering when I was there. So it's just because of the vastness of the resources that the limitation is no longer your circumstance, but yourself. And so I think that really gets you to be a self-starter, because you can't say that you can't do it.
Gosh, what a great time. You still keep up with the people you met at university?
Yeah, definitely. I was supposed to go to my 15th year reunion this year, but I don't know. Wow. Have to see how COVID is.
That's 15 years from when you started, from when you finished. 15 years from when you
finish. So I graduated in 2007. Yeah.
Right. Okay. Gosh. No, that's nice. Nice being university. What can we do to encourage insurance companies to include alternative complementary medicine insurance coverage?
Change regulation.
Change regulation, is it? By law, they can't. Is it? They can't.
Currently, health insurance in Malaysia is regulated as a general insurance product, unlike other countries where health insurance is regulated as a health insurance product. And so the question becomes, should it be Bank Negara that's regulating it, or should we be looking at a different way of regulating health insurance? Because overseas, health insurance will cover your complementary medicine, your spa, your spectacles, whatever preventive health that you need, because overall they're looking at capitation and total spend per person. And as we all know, it's cheaper to prevent rather than to treat. But this is something that I think this whole healthcare reform agenda is very important in order for us to be sustainable moving forward.
Okay. And you think there should be a healthcare reform agenda? I didn't realize there was one. What would you say are the elements of an healthcare? What were the main elements of a healthcare reform agenda?
I think looking at the payer, which is both on the private and also public insurance, because it's not sustainable for us to continue the way we are. It should be that the government subsidizes the patients wherever they go, regardless of the institution they're seeking care from, rather than specifying that if you go to this one particular hospital, then it's fully subsidized. If you go to the other hospital, it's not. That doesn't make sense. Secondly, I think it's about regulation. Looking at the changes that are happening in medicine and how the regulators can keep up. And it's not just the Ministry of Health. That's what I want to emphasize here. A lot of what we talk about in health, and you can see that in COVID, actually spans a lot of different ministries. During the COVID pandemic, we had people being admitted, children being left at home because both their parents either passed away or being admitted. Who's coming to take care of these COVID positive children? The hospital is not a daycare. So there were all these conversations that were happening, and it just drove home the point that health should be a whole of government, whole of society agenda, and not just the Ministry of Health. And looking at things like telehealth. Telehealth Act hasn't been gazetted yet. And so a lot of the teleconsultation, telehealth services that we did during the pandemic was by exemption under the emergency ordinance. And this is something that we really need to look into, right? Because things are moving on. The Nurses Act the Medical Act, have we really reformed and revised it to keep up with all the changes that are happening in society? Because the changes are happening anyway. So yeah, lots of room for reform, but primarily I think the resolving the fiscal headspace and the payer structure and ecosystem is really important.
Gosh. Okay, gosh, I didn't realize there's so many things you had to fix, but it's good. I'm glad. I'm glad you have that kind of this. But can you talk a little bit about telemedicine? This idea that I can do a Zoom call with my doctor and get diagnosed. Is that reality? Is that a thing?
Yeah, I mean, and actually that technology is not new, right? Just Zoom and
yeah,
PC
doing it
is
right
not
now,
new.
right? So let's say you're my doctor, and I say, doctor, I've got a pain in my arm. Can that happen?
Yeah, as I said, that happened during the pandemic. Basically where I see it go, and that's like really old school. Like, so where we're going towards telehealth is a lot of personal at-home monitoring, a lot of like AI and apps that are asked. I mean, even the MOH is doing that with My Sejahtera. If you're isolating at home every day, you have to answer a health assessment tool. And that's how they're monitoring thousands and thousands of patients and just picking up the red flag patients to be sent to the hospital. So all of this is being enabled by technology. So it's increasingly moving from just having a call with your doctor to actually having all these tools to sort of directly monitor your health status and triaging the people who need to go to the hospital so that the hospital is not like chocked up with people who actually would have been fine staying at home anyway. So I think that that's kind of where we're going. And we're also trying to build a comprehensive online ecosystem. So for example, in banking, everything's like end to end. You can log into your app, you can check your accounts, you can make investments, you can pay your bills. But in healthcare, what do you have? Right. So I think this is what we're trying to build, especially in TMC. When we launched Thomson Hospital Online, I clearly said that I didn't just want it to be teleconsultation. So it has an integrated medication procurement, purchasing platform. So you can do your consultation, you get prescribed your medication, you purchase it, they send it to your house. You get your medical certificate on it as well. And so it's really looking at how we can improve the patient journey end to end, because a lot of times people either don't want to come to the hospital or people are expecting, the services to come to them. That's the reality of the world today. And how are we leveraging technology to do that?
No, I was wondering, you wear something like an Apple Watch or something. It's all kinds of sensors in there. They can tell, all kinds of things. So
yeah. So definitely.
Could I hook up my Apple Watch to Thompson, and then you monitor me all the time and tell me,
yeah. So for the longest time, the ECG thing in the Apple Watch wasn't available in Malaysia. It was available in Singapore, which is why, again, I think a lot of the innovation is actually happening at our neighbor. And then we kind of get it a few years later.
Okay. That would be great, isn't it? You just have some kind of device, you hook it up to your body, and then you talk to your doctor on Zoom, and you never.
Yeah, that's essentially what happened during COVID, right? Like we gave people oximeters and thermometers, and we tell them measure your temperature, report your symptoms to us into the system. We have this COVID assessment center at Thompson. That's what we do. Like if you have category 1 or category 2, you're isolating at home, we can enroll you in, we monitor you daily. If you have red flag symptoms, we'll call you, send an ambulance to pick you up, bring you to the hospital and admit you if needed. If not, then you finish your quarantine and we just give you your release order. Yeah, so it's already happening for COVID. It will happen for other diseases as well.
Okay. Next question is just, did you face any kind, this is from Siti Masliza, did you face any kind of gender discrimination as you climbed the ladder?
Yeah, I mean, that's inevitable. But I've always thought that the youth discrimination was worse than the gender discrimination. I've had people ignore me when I come into meetings because they automatically talk to the oldest person in the room. And then, so now my staff will always say, this is my boss. So that's one of the things. And I mean, you kind of like either have to face it front on. I've told people directly that some of the things they say are sexist. Like, oh, I didn't realize that you would know so much about chillers in the hospital. And I'm like, that's sexist. And a lot of times they don't even realize it and they're making comments, right? So either just address the issue and move on, But at the end of the day, I think that, or I'd like to believe that your work speaks for yourself. And in healthcare, I think by and large, most of the employees, 80% are female. But it's just at the board level where I think the gender diversity is really skewed. And what can we do about that is just, keep calling out for diversity and pointing out that, if half of your customers are female, you can't have an all male board, right?
I was going to ask you how many women are on your board, but maybe should I ask you that question?
We have 2 and we're going to add another one soon.
Okay. Brilliant. No, I agree. I totally agree. Men had their chance and they haven't done very well, so should try something else. The next question is non-communicable disease. Other than bring awareness, is there anything else we can do to cope with this issue? Or do you think we've spoken enough on that? Non-communicable diseases, NCDs.
I think definitely the healthcare community can do a lot more to improve communication. There is an era now of disinformation, and people are looking at, where can I get trusted information from, right? And so I think, like, even right now, if you wanted to get information on the latest COVID regulations in Malaysia, there is no website.
Yeah.
So it's just, there's clear communication gaps, and definitely I think we need to do better as an industry and as a community to actually bring that awareness to the public. And it's also not just about lecturing people to eat less, right? I am a firm believer, even at the workplace, that the physical environment also shapes the way we work. So when I'm analyzing a problem in the hospital, for example, like why is there this miscommunication? I don't just look at the people involved or the process involved. I look at the working environment that they're working in, because sometimes restructuring your physical space to enable that communication makes it more sustainable change. And so I think, like, just looking at the physical infrastructure to sort of like enable that is very important, right? Because when you talk about healthy eating, do people have access to affordable, healthy food? Are we planning our cities in a way that enables physical activity for the population? And this is something that we study extensively in public health. I still remember my professors in LSHTM saying, the car is the most efficient way of converting fossil fuel to fat. And, it's just this realization of like planetary health and all the things that go around it. It's not just about telling people to eat less or cut out sugar from their diet in order to make it a sustainable change. So back to whole of government, whole of society.
Wow. Yeah, it's true, isn't it? People lost weight and ate less, and we wouldn't have diabetes, we wouldn't have heart disease, all this stuff which people go to hospital for.
Yeah, and diabetes, once you have it, it's affecting your blood vessels. It affects everything. It affects your eyesight. People with diabetes have to check their eyesight every year because you run the risk of getting retinopathy. You have to check your heart. You're at higher risk of a heart attack. You have to check your brain. You're at higher risk of stroke, higher risk of diabetic foot and amputation, higher risk of kidney failure. It's just, I think people just don't realize. They think that if you're diabetic, you can just take your insulin and life will go on. But it just increases your risk, like, so many times fold for everything else. And it's a serious epidemic that we need to look into.
No, I agree. Question now on funding. Private hospitals are great if you've got the money. But how does this work? Where people who have the money.
Yeah, so again,
healthcare and
we talk about restructuring the payment mechanism. There needs to be a public health insurance scheme and improving access to care so that it doesn't matter whether it's a public or private hospital. If you are a person in need, you will get subsidized.
Okay, got a lot of new questions coming in. Let's try. Probably we've only got 5 minutes left. Let's try one more. How do you balance work and family and being a mother and managing?
There is no balance. It's like, you just have to focus on what is required at the time. And my husband and I made a decision to only have one child because we know we didn't have time and energy to have more than one. I have a hard and fast rule that I have to be back home for dinner at 8 p.m. so that I can at least have dinner with my family. And then I make it a point to read a bedtime story to my daughter. So I have 3 fixed points and everything else has to like work around them. Sometimes you spend more time with family, other times you have to focus on work, but that's just how it is.
It is, isn't it? But I get a feeling you've always worked hard, haven't you? I mean, did you always work? I mean, you have.
Well,
and
I guess I like.
You did all your homework and you studied and you're not a slacker.
Well, I think it's more of like always wondering, like, is this the best that you can do? And if you can do better, then why not? Then see where you go. So I don't have a roadmap, but I'm just pushing myself to see like how far can I go with what I have right now. And that's just been the driving force, I guess.
Okay, brilliant. All right, so we got a one anti-vax question. Actually, I'm sorry, Nadiah, maybe you're not. I'm sure you're pro-vax. European regulations have warned that frequent COVID-19 booster shots could adversely affect the immune system and may not be feasible. What are your thoughts on this?
So I haven't read on that one, but we get influenza jabs every year, and it's still going on. So I don't think that that's COVID is likely going, if we want to head towards endemicity, which is the only way, because there's no way of eradicating COVID right now. This is the reality that we have to live with, because there are always going to be vulnerable populations. And we hope that in the future, people will have enough native immunity that they may escape not having the jab, just like in influenza, but people at risk is still recommended to have the influenza jab anyway. And the main issue with COVID was that the whole world population was naive to this virus when it first came up. And now that people have some level of sort of like immunity, we hope we move towards endemicity, but that can only happen if we stop this variant churning thing that's happening in the populations that are not vaccinated.
COVID's not going to be our last pandemic, is it?
Nope. And so I sincerely hope that we take this lesson and not like try and go back to normal and think that, this was just a blip in time, because it's not. And, we are encroaching on Mother Nature. We are making a lot of changes to our planet that are irreversible, and it's inevitable that something will come up. I mean, the more the polar ice caps melt, who knows what's going to be released? The more you encroach into the forest, I mean, maybe a tiger eating an orang asli is not the only thing that we will hear. So, these things are meant to happen. Are we resilient or have enough buffer to deal with this kind of black swan events that are certain to happen? And have we learned from what we have gone through with COVID? So I sincerely hope we all don't go back to business as usual.
Brilliant. Nadiah, it's been a pleasure talking to you, and thank you so much for spending the time. And we just, wish you all the very best for the future. And I do hope your thoughts on healthcare reform are heard by the powers that be, and that we will we will see some changes. Oh, but actually, maybe one must say you are one of the powers that be. So, you will. That's so that you will, get changes, because I think things have got to change, and I think COVID has shaken us all up.
We just do what we can with what we have, and if at the federal level it's slow, we'll just try and do what we can at our level.
That's brilliant. So all the very best, and thank you, for being in Conversations.
Thank you, Dr. Sharon and MIDF.
Virtual, lots of people applauding now. You can't hear them, I'm afraid, but thank you very much, and thank you, ladies and gentlemen, for joining us. And I hope you enjoyed these conversations. So thank you. All right, we have to press our leave buttons now.